बालिका अहम बालिका नवयुग जनिता अहम balika naham abla durvala adishakti aham ambika. I am a girl of modern time. I am not feeble or powerless. I am Adi Shakti Ambika. Namaskaram and welcome to the channel Sanskaarayurveda. Let's get started. Nothing in life is to be feared about. It's all about to understand yourself. Through the entire journey of our life, when it's about the blessing, means giving a life to in your own birth, it's all about creating yourself and reaching to an optimized level. And during all that time, we always have a lot of queries that strikes our mind. And to answer all the queries that is related for healthy progeny, we have Dr. Sarita Shrestha ma'am. She is the visiting professor of Mount Madonna Institute of Ayurveda and Yoga in USA. Let's have a talk with the epitome of Ayurveda, Dr. Sarita Shrestha ma'am. Namaste ma'am.
Namaste Divya.
Thank you for accepting our invitation ma'am.
I'm pleased and it's a privilege.
Thank you ma'am. Ma'am, when we talk about the infertility rate, when we compare it with the past time, it's increasing rapidly. Is there something related to when we plan for a baby, we always plan it after 30? Is there something related to this? Or delay marriage or delay family planning accelerate the rate of infertility?
Some part, not, we cannot just blame totally to that part. But yes, the infertility rate is increasing day by day, especially in advanced societies and highly developed countries. It's not just late marriage, but yes, late marriage is one of the major reasons. Besides that, it is lifestyle also. Like when we say lifestyle, like marriage also comes over there. But actually, the infertility cases has so many reasons behind, and there are diseases and environment. Nowadays, environment plays a big role. And beside that, in Ayurveda, it's very, very well said in Ayurveda is. I love Ayurveda because it is so close to nature, it never deviates from nature, and it always talks about nature, to be close with nature, to be with nature, And the examples that's given in Ayurveda is also always with, nature or animals kind of thing. So I just want to kind of go back a little bit so that we can understand what will be the causes behind the infertility. Okay, so infertility comes in the focus, like I mentioned, with the lifestyle, and in Ayurveda, the nature has been compared with the woman, So especially with the reproductive systems and related with the progeny or related with the fertility. So there are 4 factors. It is called 4 factors, and in 4 factors it is said Ritu, Ambu, Chhatra and Bijam. So this is all in Sanskrit words. So Ritu is compared with the season, so what is there outside in the nature is that what is there inside our nature also. So that's what Ayurveda says, right? So it also applies in a woman too. And so Ritu means season. So what is season when we talk about a woman regarding to the fertility? So that is season means the ovulation time, period of ovulation. Right after the menstruation, ovulation starts in the body, and that is the time it should be very healthy. So your ovulation should be healthy, and during the process of ovulation, there are tremendous changes happens in the body of a woman, and especially when we talk from the point of view of the modern science or Western science, let us say that way. Western science, it is considered as hormones, so whether it is estrogen and progesterone. So basically, and there also comes prolactin level also, and then thyroid also. So these are major contributing factors for infertility. But in Ayurveda, we don't have the concept of hormones. We have only the concept of blood. And if you really look at, it really justifies, because hormones are carried by blood, and so endocrine hormones, they pour hormones, the chemicals in the blood, and blood is the carrier, right? So Ayurveda doesn't go in that way. So Ayurveda says blood is the major factors, and we say it, blood is considered as pitta also in Ayurveda. So going back, so this season means the ovulation time, and this during the ovulation time, the blood circulation in the reproductive organs and reproductive tissues, what we call is artava dhatu in Ayurveda, and we also call artava shrota, right, which is the carrier, right? So that should be healthy, and if that is healthy, means the blood which carries all these nutrients to the ovaries, to the uterus, it should be healthy. And if it is not healthy, then there is a chance of having infertility. Means, in another word, the imbalance or inappropriate conditions of the hormones, right? So I'm going to kind of talk about the second factor, that is called ambu. And ambu means water. Water is a coefficient factor, and without water nothing gets combined, nothing gets bonded, and it's very important. And Ayurveda also call it as kapha, and it is considered as a nutrient. So it is a carrier of nutrients, and it also nourishes. So nourishing part goes with water and kapha in Ayurveda. And so the ambu means in outside it is water, without water no plant can be flourished, right? So it is very important beside the ritu. So seasons brings like the seasonal factors, while ambu, water, brings the essential nutrients in the form of nutrients. So it gives that nutrition to the relevant reproductive organs, and that's why it is very important. So it is compared with the nature again, right? And then next is chhatra. Chhatra means field, again, chhatra means field, means when we plant when we sow a plant, the plant needs a kind of soil, right? So soil is considered as chhatra outside, while in Ayurveda it is considered as the whole uterus. So uterus is considered, which is called garbhashaya in Ayurveda. Garbhashaya needs to be healthy, and if there is any ailments or any imbalances in uterus, whether it is in the layers of uterus, whether it is in the the membranes of the uterus, or the blood supplies to uterus, whatever. So in that case also the fertility will be kind of not possible. That means it is leading to the infertility again. And then the fourth part is bija. Bija means the seed. So without seed nothing can grow. If you have any of other three factors, still not going to grow outside. Similarly inside the woman's woman's body also, without seed it's not going to happen. You have uterus, you have ovaries, you have everything. You had blood circulation, good circulation, you're healthy. But if you don't have the healthy ovum, if your ovary garbhashaya is not producing healthy bija, dimbasaya is not producing healthy dimba, then what happens is again the fertility cannot happen, because dimbasaya, the ovums, the dimbas is released from the dimbasaya or ovary, and then the shukrakit, the sperm from the male partner comes, and they get fused in the fallopian tube, where they get fertilized, and that's how the conception happens. So after the fertilization, conception happens. So if it is not healthy, if there is a blockage in fallopian tube, if the ovary is not able to produce healthy ovums, and if there is any kind of like stricture or blockage, and then production of hormone that is produced by ovary, means again the nutrients that is necessary for dimbashay or dimba is not good enough, then the fertility cannot happen, leading to the infertility. So these are 4 factors very much emphasized in Ayurveda, especially by Sushruta. Sushruta is one of the main Rishi as well as author in Ayurveda, who is also called the father of surgery in Ayurveda. Okay, so these are 4 factors which should be very much kept in mind, and in that way, in overall, so a woman's health needs to be healthy, in another word, right? So her iron level, her blood level should be very balanced, and that means rakta dhatu should be very balanced, and then her vata pitta kapha should be balanced, and her artava shrotas and artava dhatu should be also balanced. In that case only it is possible, and that is said in Ayurveda, the earliest is better, means after the menarche. After the menarche, the age of menarche in Ayurveda is mentioned is between 12 to 16 years, and so after 16 years it is considered, it is said by all the rishis, whether it is Charaka, Sushruta, Harita, or even Kashyapa, they all have agreed that 16 is the age where a girl is considered as teenage, and from that they are going to get mature, means she is physiologically and anatomically and physiologically mature enough to conceive, although in modern concept it is not considered as a appropriate timing, but Ayurveda consider it after 16 one can conceive, a woman can conceive. So earliest means between 16 to 30 is considered as the best time for conception. So nowadays what's happening, like I am coming back to your question, so nowadays, like the life is so fast, it is so career oriented now, people, and it is bound to also, like the life has completely changed now because of the financial condition also. Both like male and female have to work, so that's why the career is in focus nowadays. So education, and then completion of education, then establishment of career, and then establishment of life is always become a priority. And after that only, like the thoughts of conceiving comes there, and this is why it is taking kind of time to postpone, had made also challenges to the conception or fertility, and that is one of the reason for infertility, especially like it's more than infertility, I will say, chances of having more like a default in like the growth of the fetus, especially like Down syndromes, and all. Also the expectation of like healthy babies are less, the death rate is high, so premature birth is also high. So it is it can be said that it leads to the one part is there, leading to the infertility.
So ma'am, as you have already mentioned that Acharya Sushruta has mentioned that after 16 one can conceive. So in a modern era, when we talk about that, not only girl, even boy is more oriented toward their career, and if we conceive in at the age of 16, it will be kind of difficult for parents to take care of baby and to take. It's all about risking your career, isn't it? So with the time, if we talk about it, how can we relate Ayurveda with the modern time to have a proper age of having a baby?
That's very true. So like the concept of the family and society, community has been totally changed from that time to this day, right? So I agree that an early stage of marriage and then early stage of conception will kind of spoil the career, and then not only career, balancing the family is also in risk. So I do agree that. But it's also true that if you look at, again, I will come back to the nature. Okay, if you look at the fruit, like fruiting a fruit, right? In the tree, you see that when it is still raw, it's of no use, right? You cannot get any juice from that fruit, and when it is about to mature, then you see that becomes juicy. Right, and when time spans, and then when it is like it is gone, it's a late. Then what happens? The same fruit, which has been so juicy, so attractive, so looking yummy, becomes not much yummy anymore, and doesn't look much attractive, as well as not that juicy also. Exactly same thing happens in our body too, especially with the ovaries and even muscles of the uterus, So the muscles of, especially the uterus, will lose the tone, like that ability of contraction and relaxation, and toning up, staying in stability, because it has got so many ligaments, right? So those ligaments also, along with the age, it also starts kind of getting loosening, like an elasticity. Elasticity gets started loosening. So exactly those phenomena happens in the body also, and the same, like ovary, which used to be like a full of juice and full of, like nourishment and nutritional factors in which is ready to, give, will slowly kind of fade up. And then it will have less of those nutrients, and because of that, what happens is during the ovulation time or during the fertilization, it won't be able to have that strength, that power, and that that juiciness, means like that nurturing factors won't be there. So obviously there is impact. But again, what we have to take, we have a choice. Like in early days, in past, the family was there always to support you back. But life has become so individualistic right now. So it is very difficult. So 22 years for male and say 16 years for female looks a little bit impractical from the scenario of today. But it is very funny, like nowadays you see, you must have heard and you must have read that there's a lot of, like school girl and college girl running away and getting married and getting pregnant and then having baby. That's a whole another issue, It is something that we have to find out a midpoint. So I will suggest, like before 30. After 20 and before 30 will be the appropriate time for both male and female. And generally it is considered as 4 years of, like difference between male and female is considered as like a best, like a compatibility. Even though nowadays there is so many, exceptional things are happening in the society. So I don't want to go there.
When we talk about healthy progeny, there are a lot of questions that arises in our mind, like what diet should I have to follow for healthy progeny, and is there something mentioned in Ayurveda before conception for healthy progeny, ma'am?
Sure. Like Ayurveda is very much based on balance. Like what you are born with is your true nature, and that has to be balanced throughout your life. That is the kind of main principle of Ayurveda. So when we are saying about balance, there are two factors very much important, and that is, it is lifestyle, but in lifestyle we have two more major things are there. One is diet and another is activities. And in that activities it comes, like exercise, whatever you do throughout your day time, it may be your work, it may be your yoga, meditation, and what you think, how do you behave with the second person, third person, how do you behave with the community, society, everything comes in that. So obviously lifestyle, it doesn't mean that like, oh, I am eating this and I'm doing this. Not. It is a kind of whole another, large scale factors. So it does impact. It has impact, and it affects a lot. And coming to your question, whether Ayurveda has any kind of suggestions or some prescriptions for a healthy progeny or for a conception. So I have written an article, and that is about conscious conception, and that has been well accepted in the West, and I have not kind of talked about this much over here. So conscious conception, if you may have heard one advertise from Ministry of Health about the family planning and about the baby. I really love that advertisement. It is like Raharle bacha janmao korle hoina. That's such appropriate kind of advertisement that I love it, and that's what Ayurveda also emphasize. Let us have the baby that we really want to have, and let the baby, the baby that we are thinking about be the way that we had thought. Right, that is very important, and for that Ayurveda has done prescribed many things, and we will discuss some of them about here. The first thing is, Ayurveda says that the couple should be consciously aware that I am ready to be a parent, right? Because sometimes, you are maybe ready outside, but you're not inside. You're not consciously not ready enough. So in that condition, parenting can be affected, right? So it is, consciousness is very important. When you are consciously ready, then you are ready to take any responsibilities behind that also. So that's one thing. And for that, it is said that Ayurveda, menarche is considered as a gateway to womanhood, she is ready for the reproductive kind of era. So in that, when woman is kind of reached to the teenage, and when she crosses teenage, she is mature enough physically, anatomically, and mentally, as well as emotionally, which is very important, right? And in that case, when she is consciously ready, both couple will they both have to decide now to clean themselves. Because in our day-to-day life, we take a lot of things inside, and that may not be good enough, or that may not be nourishing only, that may be kind of a garbage, So we do have garbage within us, so we need to clean those garbage, right? And that garbage should not be there during the conception. That is the major thinking behind it. So in Ayurveda, it is very much focused in women. Right during the menstruation, she has to follow certain kind of cleanliness. I will just go that way. Cleanliness, and the food that won't provoke any of her Vata and Pitta and Kapha dosha, especially Rakta dosha, because in women, Artava is related with the Rakta too, right? So it should not be aggravated, it should not be provoked. So that has to be kept in mind. So the food should be very light and easy to digest so that it won't create any imbalance. And for the male also, the Shukra Dhatu means that the sperm tissue in Ayurveda is considered as, it is the quality of the sperm is equivalent to the ghee, the clarified butter. It looks like, the color looks like that, the viscosity is like that, everything is, and it is as nourishing and as nutritious as ghee. So it is the essence of all tissues, 6 tissues according to the Ayurveda. So that has to be also healthy. And then to make it clean and clear, it is very well said in Ayurveda, if you have to color a cloth, a linen, it should be clean, well washed. There should not be any spot, not dirty. Then it will take very good coloring, right? If it is a dirty piece, then the coloring won't be that good. So exactly this is what the example in Ayurveda it is given, that if a parent is thinking, a couple is thinking to be a future parent, then they should also clean themselves so that the sperm and the ovum are as clean as that white linen, washed linen. And then when they come together, two clean things come together, there is no chances of any aggravation or provocations. So that is what it is said. So yes, Panchakarma is kind of advice in Ayurveda before healthy conception. So when we say Panchakarma, there is we call pre-Panchakarma procedures, that is Snehana and Swedana. Snehana is more kind of oleation, massage and all. So when we say oleation, it is internal oleation and external oleation also. And massage is very important. And then steaming, so steaming helps bringing out all the toxins from our body to the main channel so that it can be thrown out from our body. So that is considered one. And then like I already mentioned about food part, food should be very light and healthy and very, if possible, very sattvic, less than rajasic and tamasic. And then about your thought process, I mean, it's like it is said like you should be saumya. I mean, saumya means always calm and quiet and peaceful and happy. What you can think more than that, if you're in such a state of, sattvic, if you're such a state of, a peace, then everything becomes kind of very good as a result, total result. So yes, it is said, so the food should be very nourishing. And, Ayurveda is a very individualistic science, it doesn't take anything in the, totality or mass. It talks about every individual. So my choice and A may not be your choice, and your choice may not suit to my body, and so also to the ABC other person. So it is very individual. So take such food which suits to you. In Ayurveda, it means satmya to you, and then do those things which is satmya to you. So it may be Vata personality, Pitta personality. If you say a Vata person sleep 10 hours, never going to happen, right? So if a woman or man who is like a Vata personality, and if you're going to say sleep 10 hours, you should be peaceful, calm, it's not going to happen. And if you're saying sleep just 6 hours to a Kapha personality, it's not going to happen again. They will demand more, right? So this means that personality has to go through their nature, not this is the the rules, you have to do this. So one puzzle cannot be fit in all, like the pieces. One piece of puzzle cannot be fit in all. So that particular puzzle will happen in with the particular, space.
Okay.
So this is what it is saying.
Okay, means Ayurveda not only talk about physical status and physical state, it's also talk about mental state, right? To have a healthy progeny. So it's very scientific, I think. And thank you so very much, ma'am. We are blessed having you here, and thank you for your time.
It's always been my pleasure, and I'm very, very happy, especially, like you all, energetic, young, enthusiastic.